Hi, I'm Kara Taylor. I'm one of the occupational therapists here at Carroll Lutheran Village. I was going to talk to you today a little bit about low vision, go over some definitions, types of low vision, and then some treatment options and how it plays into occupational therapy. The definition of low vision is loss of sight that's not correctable with prescription glasses, contact lenses, or surgery. It also interferes with daily living activities. You're not able to read, driving, color contrast. It gets difficult to watch the television or work on the computer. Low vision affects 1 in 3 people over the age of 65, and it's not a normal process of aging. Normally people will develop some difficulty reading, but doesn't fall into the scope of actual low vision. Low vision also doesn't necessarily lead to blindness. Blindness is where you don't have any light perception at all, but it is progressive and significantly impacts your function. Types of low vision include central vision loss, where you're not able to see the center of things. There's peripheral vision loss, where you get tunnel vision, so you're not seeing around the outsides. Night blindness, and then you can have blurry or hazy vision. Some of the causes of this, I'm not going to go over the genetic conditions because that would be something that you've dealt with your whole life. But as far as the diagnoses that affect people as we age, the first one and the leading cause of low vision over the age of 65 is macular degeneration. There is a dry type, which is a slower progressing, and then there's the wet type, where you would have to go get injections, and it tends to be to progress a little bit more quickly. Early stages of macular, a lot of times you'll have some blurred vision. You'll notice slower recovery adjusting to light changes. So if you've been outside and you're coming inside, you can get distorted vision. So if you have Venetian blinds in your house, you can see where they look wavy as opposed to straight. And you can also have difficulty telling the difference between contrasting colors, especially if they're darker colors. The second type, and I have pictures. So with macular degeneration, you lose the macula, which is in the retina, deteriorates, and you have that central vision loss. So as it progresses, this would be a more normal vision, and then you'll start to lose that central vision in the middle to the point where you're not really able to see faces or really be able to read. They use the Amsler grid as like a guiding tool to see how far your visual deterioration has progressed. And the last thing that can happen that can kind of be scary for people is that you can have have hallucinations, and it's just that's mainly caused from your eyes kind of filling in the spaces of things that they're not able to see. The second type of low vision, which this one's kind of falls outside the realm a little bit, is cataracts, because they can be surgically repaired, but they're often seen in conjunction with other types of low vision. And even after surgery, people can sometimes benefit from vision therapy just to minimize the amount of the effects the loss of vision it has on your life. With cataracts, you get cloudy vision. And what that would look like, this is normal vision, and as the cataract progresses, this would be an early cataract, and then this would be the later stages where you're really not able to see any details at all. Glaucoma is where you have an increase in eye pressure that affects the optic nerve. Doctors typically treat these with eye drops that you have to put in several times a day. The first signs of glaucoma are that you start to lose night vision. And with glaucoma, you lose your periphery. So all that peripheral vision kind of disappears. So where with macular, you'll lose the faces. With glaucoma, you lose the outside. So you're not able to see, you have more of that tunnel vision. have to really make sure that you're looking straight ahead at things. You're gonna miss things on the side. So if somebody's walking up beside you, it can be an issue. Driving can be scary. The next type is diabetic retinopathy. Of course, that is just seen with people that have diabetes, and it damages the blood vessels and can cause abnormal vessel growth, which builds the pressure in the back of the eye. Best if this is caught early, because it can lead to a retinal detachment. And with that, so this would be a normal picture, and then here is where you would have a detached retina, where you'll get a black spot. And then you can also get some floaters once you get damage to that optic nerve. Hemianopsia only affects people that have had strokes, head injuries, brain tumors. So that's more specialized, but it's where you lose half of your visual field. In this case, it shows where your right eye and your left eye, where you're missing that left side on both eyes. Sometimes you can be, your one eye may see the right side of things and your left eye might see the other side of things. So it can really vary, and that is a challenge. So even say if you're gonna eat your meal, you have stuff on a lunch tray, you're only seeing half of the food. So you have to learn that visual scanning and tracking. Signs and symptoms of low vision would be reduced visual acuity. That is where you're starting to lose clarity and you miss small details in things. And you can have some contrast sensitivity with that too, where you're not really able to differentiate different things because the colors are close. You get a reduced visual field. So in those pictures that I was showing, you're not getting the whole picture. You're getting either half of the picture, you're missing the center, you're missing the periphery. You can have blurred vision, eye misalignment, where your eyes aren't adjusting the right way. So you might have one eye that is looking higher, one eye that's looking lower, or they might be off to the side. You can have issues with depth perception. You're gonna see that when you're stepping off a curb or you're going up and down stairs and you go to take that step and your foot doesn't quite hit it the right way. That would be a big issue and can lead to falls. Glare sensitivity. So you would have pain with normal lighting, or when you're going from, say, inside to outside with a sunny day, you're finding that you're needing to have darker sunglasses, or your eyes just aren't adjusting. Low vision can cause confusion, especially when you're doing visual tasks, because your eyes aren't able to pick up on, say, maybe the smaller parts of the task that you're doing. It can make it difficult to complete the whole task. You can have double vision, and sometimes you can have double vision for other reasons, and a lot of times doctors, if it's just regular double vision, doctors will give you an eye patch, or so that you're only having to focus out of one eye. Low vision can lead to headaches, to dizziness, can cause you to have abnormal posture. If you're not able to see properly, you're gonna come more forward. Your head's gonna be positioned a little bit differently. That's also gonna affect balance, and can lead to falls. And the last thing, of course, is balance issues, just with not being able to see the right way, depth perception, posturing, dizziness. So all of these things can lead to a high fall risk. Some causes of eye disease, like I mentioned before, it can be from heredity. Smoking can cause a higher risk of low vision, poor nutrition. Sometimes medications can lead to it. Say steroid use, prolonged steroid use can cause cataracts. Advanced age. So as I mentioned, over the age of 65, it is recommended that you go have eye exams every 1 to 2 years and make sure that they're dilating your eyes and they can get a good picture of, like if you're developing cataracts, they can take a look at your retina, they can see the macula, and see if there's any deterioration. The sooner you're diagnosed, the better. You can start medication and then see the right kind of specialist for treatment. once you get a diagnosis of low vision, it's a good idea to see a low vision optometrist. They do eye exams, and they provide rehabilitation. Every problem, so every different, all the different eye diagnoses will be treated differently depending on what type of vision loss you have. So they have different therapeutic approaches, and with the common goal of improving your quality of life and making sure that you can maintain your function, or at least function to your highest ability as the disease progresses. Some of the treatment options that the optometrists use are prescription glasses. They will work in the initial stages of low vision. They could try contacts. There's optical and electronic magnification devices, so whether it is a handheld magnifier, they have some, they have different strengths. They have some with lighting on them. They have glare control filters that you can use on electronic devices. Contrast enhancement, you can see that again on electronic devices. You can also offer contrast, so like for occupational therapy, if we have someone with low vision, just contrasting colors, doing black on white, yellow on blue, just where you're getting different colors and your eyes are going to be able to pick up on it a little bit more. They have eccentric viewing. You can do visual tracking, scanning. That takes some training just to get used to looking at things a little bit differently. So if you're losing your central vision, you're going to want to really learn to pick up on that periphery. And the same thing, if you're losing periphery, you're going to have to make sure that you're tracking out and able to see things on the side. They have visual field enhancements and assistive technology. So with phones, computers, they have special, even regular telephones where you can adjust the contrast, you can make the screens larger. So even if you like to read and you have an iPad, you can make the letter size, the font larger. You can brighten the screen if needed. They have spectacle magnifiers that you can use to help you read. And then they also have telescopic glasses that help you see far away. That's particularly important for trying to watch television. And then they have the big readers for anybody that is familiar with those. I think I've had the most success with patients using them for writing, for reading. You can adjust the lighting, you can adjust the font size. They take a little bit of practice, but definitely have seen where it's been more beneficial. So the low vision optometry, he or she would make referrals for additional services. They have teachers for visually impaired people. They have assistive technology specialists, which would help you determine what kind of different things would be beneficial for your particular situation. Social workers, so here on campus, the social workers can be really important, just as you adjust to the vision loss and trying to stay in your home. They have certified vision rehabilitation therapists who specialize in the eccentric viewing, the different tracking. They can come into your home and make specific recommendations that would be beneficial. They have orientation and mobility specialists. They really come into play as you're getting around the community, whether it's you want to go to the grocery store and develop a way to do your food shopping, or say you live in town and you have to be able to manage crossing the street. Support groups are a good idea. I think it's always a good idea whenever you have a chronic health condition or progressive illness that you reach out and to people that also have those issues. You can learn a lot and you just get that extra feedback and maybe think of some things that the specialists haven't thought of. The last person they can refer you to is an occupational therapist. So as far as occupational therapy services, especially here at Carroll Lutheran, there are 3 of us mainly that work here. We prefer with people that are independent living, assisted living, to work in your home. We would come in, kind of assess your environment, make some recommendations as far as modifying for safety, whether it's opening floor areas, moving cords, making adjustments with lighting. We could do adaptive equipment. So say in the bathroom, if you're getting in and out of the shower, you want to make sure that you have a handhold, because if you're not able to see where that threshold is getting into the shower, it could lead to a fall, getting on and off of the toilet. So to say, you know, if you're not lined up, or if you're not seeing the whole visual field, it's a good idea to have handholds. We can make the lighting recommendations. It's best to have overhead lighting, shades on your lamps so you're not getting a lot of glare. You want to sit in certain positions so that you're not getting the outside light that can interfere, cause eye pain. As I mentioned before, we can do the contrasting colors, whether that's setting up in your kitchen, setting up for meals. It's a good idea to have your ADL items organized. You can put your clothing together, match them by color, because you might not be able to see, especially in your closet, if the lighting's not good, if they're navy pants or black pants, or if this shirt goes with those pants. We can talk about shopping, making a store list. Medications, it's a good idea. You can get larger print labels. They have med minders. There's different ways that you can set up the directions for your medications. We have tactile cues we can put on things. We have, say for the microwave, if you use the same buttons all the time, we've used like Velcro or little bumps that you're able to feel, because you're not able to see what the numbers say on the microwave or on the coffee maker or on the remote control. We can explore leisure activity options. I think it's a great idea that people continue to do leisure activities, whether it's reading, and we can help you find some large print books, work with you on using the magnifying glasses, the large readers. Whether you like to play music or just artwork, I think it's really important to keep those leisure activities in your life, just as a way of stress relief. And then the last thing is how to start with occupational therapy. So with that, you can go to that low vision optometrist, you can go to your primary care physician, tell them that you're having some difficulties seeing, getting things done in the house, completing your ADLs, getting around the community, and they can write for a prescription for occupational therapy. Once you get that prescription, then you would call Alicia in our rehab department, and we can help you set up on times when we come out to your house and take a look at your situation. So if you ever have any questions, the rehab number is in, I'm sure you have access to it. You can give us a call, even if you want to talk to us before you go see your doctor. We're always available and open. I hope that helps. I hope you learned a little bit, and have a good day.